Today I'm going to be demonstrating how to scan a right breast ultrasound using my 12 megahertz linear array transducer and a paper plate which will represent my patient's right breast. I have my plate labeled with the clock positions since in breast scanning we use a clock scanning method since the lobes are positioned radially around the nipple. We also use a linear array transducer because it gives the best skin contact and it has a narrow focus. The 12 o'clock position represents the superior breast above the nipple, and the 6 o'clock position represents the inferior breast below the nipple. If we are scanning a right breast, the 3 o'clock position represents the medial portion of the breast, and the 9 o'clock position represents the lateral portion of the breast. And if we were scanning a left breast, these two positions would just be flip-flopped, meaning the 9 o'clock position on the left breast would mean that it was medial and the 3 o'clock would be lateral. So we want to begin with our patient in the supine oblique position, and this ensures that the breast tissue is evenly distributed and the nipple is placed in the middle. We'll have the patient place their ipsilateral arm up above their head and place their hand comfortably behind their head. To ensure that the patient is comfortable, we can use a wedge or a sponge or a pillow because sometimes, especially for the elderly patients, it is hard to stay in that position for the entirety of the exam. We also want to keep in mind that this is a high anxiety exam, so you want to be sure to calm your patient and make them comfortable, and of course explain the exam to them in its entirety. So we always begin in the 12 o'clock position in the anti-radial scan plane with your transducer in what we would normally think of is a transverse plane, but it's technically anti-radial when we're scanning breast. The transducer notch should be facing the patient's right and towards you. So we'll begin up in the infraclavicular region, scanning downward towards the nipple. And you want to make sure that you have constant pressure the entire time to increase the detail and decrease artifacts. Now when we get to the nipple, we want to angle under because it can cause a shadow artifact, and we want to evaluate if there is anything underneath the nipple hiding out. So we do not angle until we get to the nipple. So we will continue in the 1 o'clock position, scanning down towards the nipple, angle under. The 2 o'clock position, scan to the nipple, angle under. The 3 o'clock position, the transducer notch is now towards the patient's head. We're scanning towards the nipple and angling under. Now when we get to 4 o'clock in anti-radial, the transducer notch is pointing towards the patient's left, and we don't want that. So we will turn the transducer clockwise and continue our scanning to the nipple, angle under. At 5 o'clock, scan to the nipple and angle under. 6 o'clock, the transducer notch is now towards the patient's right. Angle when we get to the nipple. 7 o'clock, angle. 8 o'clock, angle. 9 o'clock, the notch is facing towards the patient's head. Scan and angle under. Now when we get to 10 o'clock, just as we did at 4, the notch will be facing towards the patient's left. So we're going to rotate counterclockwise again and continue scanning. Angle under the nipple. 11 o'clock, angle under the nipple. And now we're back to 12, and our transducer notch is towards the patient's right. Now, we will flip our transducer in what we would normally know as a sagittal plane and have the notch towards the patient's head. And this in breast imaging is called the radial scan plane. So again, we're going to start infraclavicular, scan down, and angle under the nipple. Now in radial, it's not that important because we've scanned under the nipple and evaluated that a lot in anti-radial. So still angle, but it has mostly been evaluated. When we get to the 1 o'clock position in radial, the transducer notch is towards the left again. So just as we did in anti-radial, turn the transducer counterclockwise, scan down, angle under. 2 o'clock, scan down, angle under. 3 o'clock, scan down, angle under. 4 o'clock, scan down, angle under. 5 o'clock, scan down, angle under. 6 o'clock, the notch is towards the patient's head, scan down, angle under. Now here we are at 7 o'clock, the notch is towards the patient's left again, so we will turn it counterclockwise, scan, angle under. 8 o'clock, scan, angle under. 9 o'clock, scan, angle under. 10 o'clock, scan, angle under. 11 o'clock, and now we're back at 12 o'clock again in the radial position.